They said that after the test, they said she'd had a stroke in utero. She just didn't start doing the things that babies do. And the doctors weren't real concerned about it until she, around the age of 1, they started giving her therapy and stuff, and they diagnosed cerebral palsy, of course.
Unfortunately, when someone speaks about Medicaid, they assume that because a family or patients on Medicaid, they have never contributed to, taxes or the economy, and that it's just for, quote, unquote, those people.
I guess my husband did probably pay into that. He worked for 41 years, and he paid a lot of taxes, but you don't think about it as paying into Medicaid.
That's not something you want, to come out and say, oh, I'm on Medicaid. But when you have all these other things going on, you're not just taking advantage of the government. That's everyone's, opinion of people, outlook of people that are on Medicaid. Oh, you don't want any ambition or goals for your life. No, that's not me,
That's not Camille.
We have to forget about ourselves and try to really get into the mind and into the life of the families that we're trying to help.
We had private insurance, and we were just paying the bills that were really high just as we could, It got kind of overwhelming.
I believe that parents, regardless of their socioeconomic status, educational background, family of origin, want the best for their children. And whatever that means, even if it means Medicaid, if that's going to get their child what they need, then that's what they will do.
We have to remember why we're here. It's not about you or me, or let's think about this child. And if we don't provide the care that this child needs, then multiply this child times 1,000,000 and think about what's going on in the world if we don't take care of our children.
Whenever someone talks about Medicaid or talks about helping those who need the help, no one ever stands up and says, wait a minute, what about all those people that we've helped and are now in the workforce, not utilizing the system, who have just used it as a stepping stone to get to where they needed to be?
It's not something that I'm going to be on for the rest of my life. I'm going to school, I'm getting my education, it's my hopes and dreams to one day be a rehab doctor to help people just like me. I'm not just creeping out over here on the couch, watching TV all day. No, that's not me. I want a future. I get a very nervous feeling when I think about, things getting denied or this or that going wrong or this or that getting cut from the benefits. It's a very scary feeling.
Cutting Medicaid would be a disaster for this country. I believe if our children can't get health care, they can't get their needs met, I think it'll further compound those issues that are academic, a lot more social issues. It has many ramifications that are kind of frightening to think about.
Think about the people. Think about the people before you make the cuts. Just really, truly take a second and think about the quality of life of people that you will be affecting when you make these cuts, because it will affect people.
It's not just for people who are poor, or as they perceive people who are lazy or people who don't want to work. It's for everybody, because you never know what life will turn you. You never know what's going to happen around the corner. You're working today, you're doing great today. What if you get into an accident? What if you can't work? What if you've used up all of your short-term disability, long-term disability? What if your child has sickle cell? What if your child has cancer? And that stuff hits hard and hits home. Our kids who have cancer have to spend weeks and months sometimes in the hospital. You're talking about medications for the rest of their life that are easily upwards of thousands of dollars a month, and that could hit any family. Well, now that's when the system helps you.
Sometimes we all need help to get to the point where we can help others. And never in a million years would I thought I would be here, where I am in my rehab. If it weren't for Medicaid, I wouldn't be here.